The access to safe, voluntary family planning is a human right. It is central to gender equality and women's empowerment. Yet, there are some 214 million women in 69 of the poorest countries who want to avoid pregnancy and are not using safe and effective family methods. In Belize, some women still lack access to information and services and have little to no support from their partners and communities. The UNFPA says that family planning is critical and a key factor in reducing poverty in developing countries like Belize.
So even in humanitarian and crisis situation, is family planning is life-saving intervention. It prevents unintended pregnancy and in turn reduces health risk of childbirth and recourse to unsafe abortions. The rights of women and girls to decide freely and for themselves on whether, when, and how many children to have brings women and girls more opportunities to become wage earners, boosting family income levels, and as women gain access to productive resources, they also report better health outcomes. They achieve higher levels of education and experience a lower incidence of intimate partner violence.
The teen population faces a growing number of unplanned pregnancies, which contribute to a high number of child mortality and cycle of poor health. Here in Belize, 74 of every 1,000 births are to adolescent mothers, mostly those from rural and poor communities.
Key to note that Belize is at 74 per thousand. It is a fact that for some adolescents, pregnancy and childbirth are planned and wanted, but for many, they're not. Adolescent pregnancies are more likely in poor, uneducated, and rural communities. Some girls do not know how to avoid getting pregnant. That is because sex education is lacking in many countries. They may feel too inhibited or ashamed to seek contraception services. Contraceptive may be too expensive or not widely or legally available. Even when contraceptives are widely available, sexually active adolescent girls are less likely to use them. Adolescent pregnancy and childbirth is associated with greater health risk to the mothers. That is where we would get low birth weight for our babies, and there would also be some other complications of pregnancy and childbirth, which are leading cause of death in adolescent girls aged 15 and 19.
But unplanned pregnancies are not always unwanted. Teen mother Ishel West says raising a baby at a young age wasn't easy, but the support from home helped her to continue her studies to build a better life. She says, however, that other teen girls do not have to experience what she did.
I'm asking parents, kindly, even if you think it's shameful or something, you can implement birth control, because we cannot stop females in our generation now. It sounds simple because, oh, they're in school and what's not. But I ask, it's better that you guys implement contraceptives instead of aborting or dealing with the situation that I went through. I must say, if it was something that should happen again, I would pursue my goals first, then think about having a child. But it happened the way it happened, and I'm a proud teen mom.
But the reality is that most teen moms do not have the support like Ishel West. And so the UNFPA has developed an integrated strategic framework that aims to reduce adolescent pregnancies by 20% by 2019, a goal they set for the English and Dutch-speaking Caribbean since 2014, including Belize. And so in Belize, there's a need to protect young girls and boys, starting with reaching into the farthest corners and go even into schools and homes to inform and provide health services.
Sexual education is very important. Personally, I think it has to be in all schools. But most importantly, parents need to take responsibility in starting that conversation at home. I think you should give children all options. Abstinence, Why? Because you're still young, because you're still growing, because you're not mature enough. That's not what you do right now. Right now, you should be focusing on your studies. Contraceptives, you have to teach your children about contraceptives. And it's not only to our boys. We tend to empower our boys by telling them that they should use a condom. What do we tell our girls? Nothing really. So we need to start also empowering our girls. And when I talk about rural areas, I'm talking about the people in PG that are living in Otosha, that don't have no cable, that don't have no internet access. That's what I'm talking about. And so that's why it has to be a multi-sectorial approach. It has to be with the Ministry of Health, because the Ministry of Health has their nurses that are in those regions.
Reporting for News 5, I'm Andrea Polanco.